Hi, I'm Dr. Kenneth Thatcher. I'm a family doctor and Bible teacher. I do videos on health, faith, and relationships. If you're not subscribed to the channel, I encourage you to subscribe and become my friend and receive future videos when I upload them. In this video, we're going to be talking about how your doctor goes about treating generalized anxiety disorder, or what people generally call anxiety. If you're suffering from anxiety or know someone who's suffering from anxiety, this video is going to provide you the medical information that you need to be able to feel confident and understand the choices that you and your medical doctor are going to be making to treat your anxiety disorder so that you can feel better soon. There are several ways that we treat generalized anxiety, and there are two main ways to be exact. The first is by using psychotherapy, specifically cognitive behavioral therapy, and the second is by using pharmacotherapy, which is using medications. There is a third method using complementary therapies such as botanicals and vitamins, which we will discuss in a future video. But in today's video, our focus will be on discussing how we use medications to treat generalized anxiety disorder. The structure of our discussion is going to be made up of 4 parts. We're going to talk about, in part 1, how we go about determining the type and need for treatment. Then in the second part, we'll talk about the initial pharmacotherapy for generalized anxiety disorder. Then in the third part, we'll talk about subsequent or follow-up treatment for generalized anxiety disorder. And in the fourth part, we'll cover treatment of drug-resistant generalized anxiety disorder. Let's get started with the first part. So how do we determine the need and type of treatment for patients with generalized anxiety disorder? In a previous video, we talked about diagnosing generalized anxiety disorder, and we discussed diagnosed into mild, moderate, and severe generalized anxiety disorder. If you've not watched that video, I'll put the link to it in the comments below. It's an important video to watch prior to this one. Now, with discussing and looking at the determination of need for treatment, we're going to be looking at the mild, the moderate, and the severe. And we see that with people that have mild generalized anxiety disorder, their symptoms don't bother them too much. They're able to work and still live their life fairly normally. These people may elect to not get any treatment initially, and in that case, we will follow such patients at least every 3 months to reassess and make sure that they're doing well and that they do not need further care. For people with moderate or severe generalized anxiety disorder, they need treatment. And the choice of treatment is going to be between cognitive behavioral therapy or pharmacotherapy. How we go about choosing which type, whether medication or cognitive behavioral therapy or both, depends on the patient's preference and also the severity of the disease that the patient is suffering from. Some patients are going to not want to take medications. They don't like the side effects. They don't want to put themselves at risk of it, and they prefer to go the natural route, as they often call it. Then some people who might otherwise be open to cognitive behavioral therapy might not be able to fit it in their schedule because they might need to go to visits about once a week or several times a month, and they might not be able to make that work. I have patients sometimes who don't have transportation to go to these places, and different considerations like that are brought into the equation to decide what type of approach we're going to use for a specific patient. For patients that have severe anxiety especially, we often would at some point want to recommend both, because research has shown that a combination of both cognitive behavioral therapy and medication works much better. The two work about the same. So the choice of one or the other really it depends on patient preferences and other things that are going on because they work about the same. But a combination of both, it works so much better. So depending on disease severity, we would recommend both also for consideration. What is the initial treatment for generalized anxiety disorder? A group of medications called SSRIs and SNRIs, which stands for selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, are the first line agents for treating generalized anxiety disorder. They are preferred over older antidepressants called tricyclic antidepressants because they have less side effects. They are also preferred over other medications that can treat generalized anxiety disorder like benzodiazepines because they don't pose the risk of dependence and addiction that benzodiazepines pose. There are several types of medications that fall into these two groups, into SSRIs and SNRIs. For example, citalopram, escitalopram, paroxetine, fluoxetine, and sertraline are examples of SSRIs. Examples of SNRIs include duloxetine and venlafaxine. So how do these medications work? These medications work by inhibiting reabsorption of serotonin and norepinephrine in the synaptic cleft in the brain. So the way it works is that the neurons in your brain have a space called the synaptic cleft that exists between them. There's communication that has to take place across the synaptic cleft for neuronal information to go from one neuron to the other. This information happens through the use of chemical agents called neurotransmitters, and examples of them are norepinephrine and serotonin. Well, research has shown that in people with anxiety disorders like generalized anxiety disorder and depression, the amount of serotonin and the amount of norepinephrine found within the synaptic cleft is usually lower than needed. And so medications like SSRIs and SNRIs that increase the amount of these neurotransmitters within the synaptic cleft help in treating depression and generalized anxiety disorder. So these two medications work by reducing resorption or reabsorption of these neurotransmitters and therefore increasing the amount within the synaptic cleft. So what are some of the side effects that we have with these medications? And it's very important to note side effects very early in the treatment because many of these medications will cause some side effects like agitation and insomnia that would cause some patients to stop taking the medications before the medications have had a chance to work. It takes about 4 to 6 weeks or a little bit less sometimes for these medications to fully become effective and start working. And when some patients start having these symptoms, they stop the medications before the medications start working. So it is important to work with your doctor to be able to identify and treat these early symptoms before they cause you to stop your medication. There are other symptoms besides agitation and insomnia that you can have when you take these medications. You could also have GI symptoms like nausea, vomiting. You can have erectile dysfunction symptoms that occur with taking this medication. Some of them can cause weight gain. And an important side effect rather that can happen when you take these medications that is important to talk with patients is suicidality. This doesn't happen in most patients. It's somewhat rare, but it's a very serious one that you need to know. In some patients, some of these antidepressants, all of them really, can cause you to have more thoughts about hurting yourself or hurting someone else. So if you start having these symptoms when you're taking the medication, the recommendation is to stop taking the medication and call your doctor. And if the ideation is very significant, you should go to the emergency room for care. How do we manage some of these symptoms early so that patients can continue to take their medications? Well, there are three different medications that we often use to manage symptoms. We would use a medication called hydroxyzine, and we can use medications also like gabapentin if that doesn't work, and sometimes we use benzodiazepines like alprazolam and lorazepam when needed to treat these symptoms. Another way that we reduce these symptoms is by making sure that we titrate the medication slowly. We start with a small dose at the lower end of the recommended dosing, and then we increase gradually to the therapeutic dose. We've discovered that when we do that, the patients suffer less side effects and do not need medications to be able to help them, and many do not stop their medications because of symptoms that occur early on. How do we decide which medication to use? Research has shown that these different types of SSRIs and SNRIs are equally efficacious. They work about the same. The choice of medication that we use in a patient is influenced by the side effect profile of the specific medication. It's influenced also by the patient's comorbidities, the things that the patient already has, and also by drug-drug interactions and patient history. For example, if a patient has taken a medication before and it's worked for the patient, we'll likely continue the medication. In terms of comorbidities of the patient, if the patient is sensitive to weight because they are already struggling with weight, we avoid using medications like paroxetine and citalopram that have side effects that include weight gain. These medications cause patients to gain weight, so we wouldn't give it to a patient who's struggling with weight. We'd rather choose a medication like fluoxetine, which is weight neutral and doesn't cause people to gain weight. If a patient is struggling with a medication with, for example, significant erectile dysfunction symptoms, we might give the patient a medication like duloxetine. If a patient is also struggling with significant insomnia, we might choose a medication like paroxetine that is more sedating and will help them when they take it at night so they can actually go to bed. So we consider things like that to choose a specific medication for a patient. Now we move to looking at subsequent management. At a follow-up visit, we now see this patient that we had started medication on and managed, and we're going to evaluate the patient. The patient would likely fall in three groups, one of three groups. The patient is being treated well, they're responding well to treatment. In that case, we continue the medication and continue to follow up the patient at intervals to see how they're doing. The second group of patients are patients that do not respond to the medication. After starting the medication and following up in 4 to 6 weeks and reassessing, the patient is not responding to therapy. In which case, then we're going to first consider cognitive behavioral therapy, and we will also switch the medication. We'll stop the old antidepressant, SSRI or SNRI, and we will titrate a new medication. As has been mentioned before, research has shown that these medications work about the same. Something that research has also shown is that when a person doesn't respond to one medication, it's not an indication that they will not respond to all antidepressants. It's just that they haven't responded to that specific medications, and all we need to do is switch them to another medication that can work for them, as we also consider cognitive behavioral therapy. Another group of people are people who would have partial response to treatment. These people get better, but not quite. In this case, the recommendation is to augment or supplement what they're currently taking, the SSRI or SNRI they're currently taking, with another medication called buspirone or Buspar. That's the first line medication that we use to augment medication. If augmentation with buspirone or Buspar does not work, we would consider medications like gabapentin and pregabalin. In some patients who have mood instability, they are very agitated or excessively irritable, we work with psychiatrists who might be able to start mood stabilizers in these patients depending on everything else that the patient has going on. We've now come to the fourth and final part of our discussion, which is addressing drug-resistant generalized anxiety disorder. There are several other medications that we can use to address patients who have failed multiple medications, and we can start other antidepressants. We can start medications like mirtazapine. This is an antidepressant that works by inhibiting serotonergic and adrenergic receptors. It is frequently used when patients are having problems with appetite because it increases appetite. It's also helpful for patients that have insomnia because it's very sedating. Another group of antidepressants we can use is the tricyclic antidepressants. And these medications, examples are imipramine, amitriptyline, nortriptyline. And their side effects profile are the reason why they're not first line, but they're second line because they can be quite effective in patients who have failed treatment with SSRIs and SNRIs. Then there are the newer antidepressants like vortioxetine and vilazodone. These medications were first introduced in the US in 2011, 2013, and they are quite effective, but they're not used as first line because they're very expensive and they're newer. We use the more established, older SSRIs, SNRIs first, and when that doesn't work, we consider these newer ones. We can also use second generation antipsychotics like aripiprazole and quetiapine. Another group of medications that we might use in patients who are resistant to treatment is benzodiazepines. We can also use medications like hydroxyzine. Well, that's a brief run through of how your medical doctor is going to work with you to be able to treat your generalized anxiety disorder. I hope that you've benefited a lot from this video. Please go ahead and like and subscribe to this channel. Like the video, subscribe to the channel. And if you have any questions, put them in the comments below and I would love to help you. If you're a person of faith and you need prayer, I'll be very, very happy to pray for you. I'm someone who believes that science and faith go together. I'm a physician. I have a doctorate in spiritual formation and a doctorate in medicine. And I feel that good medicine, the best medicine, goes together with the best prayer. So if you need prayer, please let me know and I'll be happy to pray for you. And if you have a question on the aspect of medicine as it has to do with your generalized anxiety disorder, I'll be happy to answer that for you as well. I wish you well and I'll see you in the next video.